Hi, this is Dr. Rod one more time with 17th Street Chiropractic, and today I'd like to talk to you a little bit about a question that I get all the time, which is what is the cracking noise that happens when we do adjustments to the patients? So in order to understand that, let's go back a little bit to what we talked about on a couple of videos ago, how the joints work. Okay. First of all, joints are alive. We talked about this. Like any other part of your body, they need sustenance to survive, and they need to get waste out. And how that works is by movement. When the joints move, waste comes out and nutrients come in. And because joints, they don't have a whole lot of blood supply going to them, movement is crucial for that exchange of fluids in between the joint and the surrounding tissue, because they get all their nutrients, most of their nutrients, from the surrounding tissue. So as I said before, it works kind of like a syringe. When you move, the joint pulls all the nutrients in, and whenever you move again in another direction, it pulls all the waste out. So it's a constant exchange of fluids, just like you would have with a syringe, pulling it in, or bringing all the fluids in, and then you push it out, it goes all the way out. So that's how mostly the joints work. Okay, so what is that cracking noise when we do the adjustments that everybody here and they all think related to chiropractic when we do the adjustments? So a few things. One, I'm going to explain to you why the noise is not necessary to have a successful chiropractic adjustment. A lot of patients, I have a doctor, a friend of mine that calls, is addicted to the crack. So yeah, it's good. It gives you a good notion that the adjustment was successful because you hear that noise, but it's not actually necessary. So what is the actual noise into the joints when we do the adjustment? So there's a lot of different theories about it. No one knows like exactly for sure how that happens. The most common accepted notion right now is that it's gas coming out of your joint. Whenever you do the adjustment, it releases gas. And that's fine, but it doesn't really make a whole lot of sense to me. Okay. What I like to think of is that the joint, because of that pressure that I told you before, the exchange between the fluids, it works kind of like a suction cup. So whenever you have fluids going in, it sucks that those fluids in. Whenever you pushing it out, it pushes it out, just like a syringe. So it works kind of like a suction cup. Whenever you have subluxation, that's a chiropractic term for the joint not moving properly the way it should, the joint gets locked up in a place, so you don't have that exchange of fluids going in and out. Whenever the joint is stuck like this, there is buildup of pressure either outside the joint or inside the joint. So that's what I think the noise comes from. So whenever you have the motion of the chiropractic adjustment going into the joint, it actually puts pressure outside or inside the joint. It lets that joint open up and release of that pressure. And it, as I said again, works kind of like a suction cup. Whenever you pull the suction cup out of a wall or something, it has that noise. And that's the same thing with the joint. Whenever you have that motion going in and the joint opens up, the pressure is released, and you hear that noise. And you have several cracks, usually because you're affecting more than one joint at a time. So you're having several cracks going on either in your neck or in your back or your low back. So it's mostly a release of pressure from the joint or outside the joint going into the joint, because it has been stuck in that position, and either there's pressure trying to get out or pressure trying to get in. And with the chiropractic adjustment, it lets that exchange of fluids and it regulates the pressure in the joints. Now, so that's where the noise comes from. So it feels good whenever you have that going, because as I said, the pressure is balanced, so you don't have something feeling like there's something pushing in or pushing out of the joint. You don't feel stiff, you don't feel like the joint is stuck in the position. So it feels pretty good. But is that necessary to have a successful adjustment? No. The joint can be out of place and still having that exchange of fluids. Okay, so the most important part of a chiropractic adjustment is actually to put the motion into the vertebra or the joint or whatever it is that we're adjusting, so it goes back to its correct position. So if there is not an exchange of pressure going on, if there's not a pressure going in or out that is stuck, you won't have the noise with the adjustment. But the most important thing is that the chiropractic adjustment is putting the joint back in its correct position, even if there's not that pressure built in inside the joint or outside the joint. So you won't always have the noise, but it's important to note that even though you don't have the noise, you can still have a successful chiropractic adjustment because we're moving the bone back to its correct position. So most of the time you do, because whenever a joint is stuck out of place, the pressure builds up and you cannot have that exchange of pressure, but sometimes you don't. You can still have a little bit of exchange and not build up a pressure. So that's why it's important. That's where the noise comes from, and that's why you won't always hear a cracking noise whenever you have an adjustment, but that adjustment can still be successful. Okay, so again, this is Dr. Rod with 17th Street Chiropractic. I hope this helped. I'll see you next week.